side?
It's totally fine.
This side. All right, so the first test is Cozen's test. So this is a person that might have lateral epicondylitis. So if we can go just right off the lateral epicondyle and feel down here, that's something we want to start with, just pushing in there. The patient would be complaining of pain right in that area, so just pushing there, you kind of already know what's going on. But Cozen's test, we're going to have the patient kind of make a fist, maybe slightly extend it. We're going to be having the person really use these extensor muscles of their wrist. So I'm going to keep you down just a little bit. Don't let me push your hand towards the ground. If you see here too, I'm trying to really isolate the wrist. So I'm holding right here at the proximal wrist, and then I'm going to be just pushing on the hand. And she's really using those wrist extensors, and it would really hurt right there at the lateral epicondyle. Did that hurt you?
No.
Okay. Cozen's was negative. So another one is to have her hold her hand out. This is modified Cozen's. And I'm just going to say, don't let me push down on your middle finger. Really stressing extensor digitorum tendon, which is one of the main muscles and tendons that goes up there. And that would be weak or most likely very painful across that area leading into the lateral epicondyle. It's also known as tennis elbow, right? Tennis elbow is lateral epicondylitis. A lot of times people that are overusing their kind of wrist extensors with that backhand motion could do that, but we see it with all sorts of stuff. The other one is the golfer's elbow, which is pain right there at the attachment of the flexor muscles to the medial epicondyle. So very similar test. I'm going to have you make a fist, maybe slightly flex it. Don't let me push your wrist into extension. So she's really going to be using and stressing these flexor muscles. And any pain there? Nope. If she did, it would hurt right there. We'd know it. These are they're good tests. They're easy to do. That was golfer's elbow test. All right, so a couple other tension tests. One is the ulnar nerve tension test. If there is a peripheral ulnar neuropathy, over time we might see a flexion contracture of a patient where they start to have kind of that, what they call the claw hand right there. But a way that we can really tension that nerve route is to have the patient try and make an OK sign and then try and put that and make a kind of a goggle out of it. Can you try that?
Just with this one?
Just with your right hand, yep. Any pain reproduction there?
No.
Look at that. So we're tensioning that ulnar nerve as much as we can, and she's not having symptom reproduction from it. The next nerve we can look at is the radial nerve, and with that we might see the patient coming in with complaints of drop wrist, a wrist drop, and lack of ability to extend her fingers to some degree, but primarily wrist drop. We can tension that too. Why don't I have you lay back, head this way. So this one, what we're going to do is we're going to fully, I'm going to just depress her shoulder. We might be looking for symptom reproduction. I'm going to fully pronate her hand. That is a way to tension the radial nerve, and she might be having pain. And then kind of the last component, I'm going to have you just laterally flex your head, try and touch your ear to your left shoulder. And we're looking for symptom reproduction, electrical zinging nerve type pain. Any pain there?
No.
She's doing great. All right. Okay, and then the last nerve is the median nerve. And it's primarily compressed here at the carpal tunnel, and we'll look at some tests there, but we can also tension that nerve route. This is your good side?
This is my good side.
So here, this one's a little bit complex, but I'm going to try and depress her shoulder. And any one of these we can look for symptoms. I'm going to also keep her elbow bent. I'm going to extend her wrist and fingers, and also to some degree supinate those structures. And then I'm going to extend her elbow. Any pain there? So she's supinated, going into an extended position. And why don't you laterally flex your head away, try and touch your ear to your shoulder. Any pain, zinging, reproduction of symptoms there?
No.
Nope? Okay. Great. So let me sit you up here. So that was the tensioning of the median nerve. Now we can just do some hammering on it. So right here at the carpal tunnel, you can make some reinforced fingers. We're going to just do Tennell's tapping right at that nerve where it becomes inflamed and swollen, looking for symptom reproduction. Typically the person would have numbness, tingling sensory alteration in the thumb, index finger, middle finger, maybe a little bit of the lateral side of the ring finger. Did that irritate you at all? No pain reproduction? No. Sometimes people have some retrograde pain too. That's possible. Another test we can do is called Phelan's. Can you reproduce this position? I want you to just kind of push your wrists together. We're going to hold that 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 30. Are you having any symptom reproduction?
Nope.
Nope. She would, maybe in that area, be having pain, sensory alteration. her symptoms are getting worse. The other test we can do is reverse Phelan's. So I'm going to get you in that position. We're going to hold it maybe 30 seconds to a minute. Okay. Any symptom reproduction there after 30 seconds to a minute? Just in the shoulder.
Just that one.
But nothing in your wrist, fingers. Okay. So she doesn't look like she has any median nerve issues going on.